After determining what nurses do, it is now important to know that there are many different types of nurses. How many different types of nurses are there? There are cardiac nurses, registered nurses, licensed practical nurses, and even certified nurse assistants. The list goes on and on. There are at least 65 different types of nurses, if not more. One example is a case management nurse. The most important part of nursing is being a patient advocate. Everyone has heard about the notorious sponge bath at one time or another, I'm sure. A case management nurse is a licensed nurse who coordinates patient care in a specific setting in order to provide optimal treatment. A case management nurse has several areas of care. He or she coordinates long-term care for their patients. The most common type of job position for a case management nurse is in a hospital or a medical facility. Others work in retirement homes, rehabilitation centers, insurance companies, government agencies, or hospices. Many case management nurses work closely with physicians, social workers, other nurses, and a wide range of medical and non-medical professionals. A case management nurse has many common tasks. Each and every one of us at some point in our lives has had to deal with or has dealt with nurses. I want to express the importance of nurses, whether it be a case management nurse or any of the other 68 kinds of nurses. Without nurses to help with their health care, what would the world do? Nurses are there to bandage our wounds, give vaccinations, and inform us of our healthcare needs. The most important part of nursing is being a patient advocate. Nurses are there for their patients, not for the doctors. Nurses are also our first line of defense that patients frequently come into contact with when we are ill. It is often said that nurses treat the patients and the doctors treat the disease. After learning to care for my stepdaughter, who had osteosarcoma, which is a tumor in her leg in the bone, and my fiance, who had squamous cell carcinoma in his neck twice, I have a new profound respect for the world of nursing. I believe nurses are special people. How about you?